Cardiac and circulatory conditions in BOAS. Cor pulmonale occurs when chronic airway obstruction and low oxygen levels cause pulmonary vasoconstriction, increasing pressure the right ventricle must pump against. Over time, this leads to right-sided heart enlargement and failure. Clinical signs: exercise intolerance, rapid or labored breathing, syncope, collapse, especially during excitement, distended jugular veins, ascites, late stages, muffled heart-lung sounds. Treatment options: correct BOAS surgically to reduce hypoxia, oxygen therapy during crises. Diuretics, if right-sided CHF present, may be used in select cases. Weight reduction and heat avoidance. Monitor via echocardiography. Cardiac changes in BOAS dogs are secondary to chronic airway obstruction and hypoxia.
In BOAS, secondary pulmonary hypertension occurs due to chronic low oxygen from airway obstruction causes persistent constriction of pulmonary arterioles, leading to increased pulmonary artery pressure. This elevates workload on the right heart and may precede cor pulmonale. Clinical signs: exercise intolerance, fainting or collapse, coughing sometimes, increased respiratory effort, right-sided heart enlargement on imaging, loud or split S2 heart sound. Treatment options: primary intervention, BOAS correction to restore airflow, sildenafil, commonly used to reduce pulmonary arterial pressure, oxygen therapy when needed. Treat concurrent conditions, for example, aspiration pneumonia, regular echocardiography to monitor severity, improve the airway, improve oxygenation, reduce heart strain. My bulldog collapsed at the park, and the vet found irregular heartbeats, arrhythmias, hypoxia, and increased vagal tone from airway obstruction predispose BOAS dogs to arrhythmias, especially sinus arrhythmia, atrial premature complexes, APCs, and ventricular premature complexes, VPCs. Severe stress, overheating, or airway obstruction can precipitate dangerous rhythms. Clinical signs: irregular heartbeat, episodic weakness, exercise intolerance, collapse, restlessness or anxiety, tachycardia during respiratory distress. Treatment plans: treat the underlying airway obstruction, Holter monitoring or ECG for diagnosis, antiarrhythmic therapy, for example, atenolol, sotalol, if clinically significant. Avoid heat, overexertion, and stabilize concurrent hypoxia or electrolyte abnormalities.
Your dog's heart murmur might disappear the second they can breathe properly. Functional systolic murmurs, flow murmurs. These murmurs occur due to turbulent blood flow caused by increased cardiac output during respiratory distress, not because of structural heart disease. They often resolve once BOAS is corrected. Clinical signs: soft systolic murmur, usually grade 1 to 3. No radiographic signs of structural heart disease, may vary with excitement or respiratory effort. Murmur intensity decreases when breathing improves. Treatment options: correct BOAS to reduce cardiovascular strain, echocardiogram to rule out primary cardiac disease. No specific cardiac treatment is typically needed. Monitor murmur progression. Owner education about functional versus structural murmurs.
Because brachycephalic dogs work harder to breathe, their hearts and circulatory systems can experience extra strain over time. Conditions such as elevated blood pressure in the lungs, fainting episodes, and heart enlargement may develop if airway challenges go unmanaged. With regular checkups, early detection, proper weight control, and timely treatment of breathing issues, most cardiac and circulatory problems can be minimized. Taking a proactive approach helps protect your pet's heart health and supports a longer, more comfortable life.